Hi friends. Welcome to Dentistry Love Channel, Bleaching Part 3. Vital bleaching technique includes home bleaching, in-office bleaching and OTC, over-the-counter, bleaching. Home or night guard bleaching. It's a simple technique whereby, after an initial consultation with the dentist, mouthguard or tray is made for the patient to whiten the teeth at home. Advantages include: it's simple and fast for patients to use. It's cost-effective. Patients can see the results quickly. Patients can whiten their teeth at their convenience, according to their personal schedule. Disadvantages include: the color change is dependent on the amount of time that the trays are worn. The system may be open to abuse by use of excessive amounts of whitening agent for too many hours per day. It's difficult for patients who gag easily to tolerate the whitening trays at home. Impression taking. Excellent impression reproducing the surfaces of upper and lower teeth should be taken so that the whitening trays can be made. Tray should be made of bioinert material. Tray design features: full vestibule upper or lower trays, tray with or without reservoirs, trays with or without windows. Loading and placement of trays. A syringe loading gel is placed. A blister pack application seals the tray and compresses to ensure that the gel is placed properly. Here, the pic explains the same. Procedure. Once the tray is fabricated, upper trays are supplied first to the patient and asked them to use it for 1-2 weeks based on discoloration. After 2 weeks, review is done to assess the whitened shade of upper teeth. Tray should be worn overnight. Then lower trays are supplied to the patient and asked them to use it for 2 to 3 weeks, then review is done to assess the whitened shade of lower teeth. Desensitizing toothpaste can be used 2 weeks before whitening as a precaution to sensitivity after bleaching. Bleaching instructions: apply a very small drop of bleach in each tooth space in your tray, just enough to cover each individual teeth. Shouldn't use more. If excess bleach spills over onto the gums, wipe it with cotton buds neatly. At first use the bleaching system for couple of hours, gradually increase the length of time you wear it. Leave it overnight if you're comfortable with it. Remove the trays and rinse your mouth with lukewarm water and do the same with trays. Don't use bleaching gel more than once. Don't brush your teeth for 20 minutes after that and you may feel your teeth little sensitive. Protocol for whitening. At first appointment, conduct examination, consultation and treatment planning. Then at the next appointment, obtain consents, explain the risks and benefits of procedure. Supply upper whitening trays. Followed by whiten the upper teeth first and review after 2 weeks. After 2 weeks at the 4th appointment, assess the patient and check for side effects. Review the shade of upper teeth, check sensitivity and supply more whitening gel. Supply and fit the lower whitening tray. After 3 weeks of whitening of the lower teeth, review the whitened shade at the 5th appointment. Then, review the shade of the lower teeth and see whether whitening is completed, followed by reassess the final shade at 7th appointment. Side effects of bleaching include soft tissue irritation, gingival irritation and tooth thermal sensitivity, which is the most common one among these three. Soft tissue irritation: it may be from overwearing the trays or applying too much whitening agent to the trays. Gingival irritation or painful gums: check whether the tray is fitting properly and not impinging on the gingiva. The trays may need to be adjusted, trimmed back or polished. Tooth thermal sensitivity: Desensitizing toothpaste can be used 2 weeks before whitening, by brushing the teeth with the desensitizing toothpaste or into the whitening tray or directly onto the sensitive parts of mouth. Neutral sodium fluoride gel can be used for desensitizing, applied directly with brush onto the teeth, or it can be placed into the whitening tray. Proprietary agents containing potassium nitrate can be applied directly into the tray. The tray can be worn overnight. Thank you friends. Please do subscribe for more videos.